anytime you're implementing something big, there's going to be people who are nervous and anxious about, is it going to get done, until it's actually done. But let's just step back for a second and make sure the American people understand what it is that we're doing. The Affordable Care Act, Obamacare, has now been with us for 3 years. It's gone through Supreme Court tests. It's gone through efforts to repeal. A huge chunk of it's already been implemented. And for the 85 to 90% of Americans who already have health insurance, they're already experiencing most of the benefits of the Affordable Care Act, even if they don't know it. What is left to be implemented is those provisions to help the 10 to 15% of the American public that is unlucky enough that they don't have health insurance. And by the way, some of you who have health insurance right now, at some point you may lose your health insurance. And if you've got a pre-existing condition, this structure will make sure that you are not left vulnerable.
After the signing of the Affordable Care Act, sociologists and policymakers continue to focus on reducing racial health disparities by increasing accessibility. We believe that this disregards a cultural perspective. They are forgetting that African Americans have a serious distrust towards healthcare that has been caused by a history of biological racism and unethical research. We propose that in able to reduce healthcare disparities, we must first regain trust.
In Harriet Washington's Medical Apartheid, The Dark History of Medical Experimentation on Black Americans from Colonial Times to the Present, she provides the history of the many occurrences of the unethical treatment of the slaves. She explains that there is a different set of ethical standards where non-consensual and dangerous experimentation on Black Americans by medical researchers are the norm. These medical experiments on Blacks were completely endorsed because of the biological racist ideology. Many researchers propose that Blacks were biologically different to the extent that Blacks and whites experienced different morbidity. Blacks were viewed to be immune to certain diseases that were prevalent in white communities. The continued reports on Black inferiority perpetuated the idea that the use of racial experimentation to advance medicinal research was acceptable and essential for the rest of the population. This medical research on Blacks is widely spread across the United States. At more than 60 research centers at premier universities, there has been experimented-related deaths or scientific fraud.
Racial disparities exist between Black and white Americans in the medical field regarding trust in physician practices and treatment. A prime example of this is the Tuskegee study. Between the years of 1932 and 1972, this 40-year experiment was conducted by the U.S. Public Health Service on 399 Black men in the late stages of syphilis in Macon County, Alabama. Unfortunately, the participants in the study were never told what syphilis was or of its seriousness. The men, for the most part, were illiterate sharecroppers from one of the poorest counties in Alabama.
Medical experiments like the syphilis study have created a culture of distrust that is prevalent throughout the Black community. Because of this, Blacks are less willing to regularly see primary care physicians for their heart disease, diabetes, or cancer. This lack of consistent medical counsel puts them at a higher risk for acute illnesses and mortality than their white counterparts. We do not believe that we can erase the past, but we do propose that the medical community should be aware of this distrust and do everything in their power to regain it. Bill Clinton set the example for how to start this process.
So today, America does remember the hundreds of men used in research without their knowledge and consent. We remember them and their family members. Men who were poor and African American, without resources and with few alternatives. They believed they had found hope when they were offered free medical care by the United States Public Health Service. They were betrayed. Medical people are supposed to help when we need care, but even once a cure was discovered, they were denied help and they were lied to. What was done cannot be undone. But we can end the silence. We can stop turning our heads away. We can look at you in the eye and finally say, on behalf of the American people, what the United States government did was shameful, and I am sorry.